Hello, and welcome to Facebook Live with Dr. Brie. I have my official first fireside chat. It's really exciting. I actually have today as a relative off day because I had a wonderful osteopathic hands-on manipulation course over the weekend where I just was bathed in continuing medical education with an excellent local teacher, Gail Wetzler. She's a physical therapist teaching me all about how to feel all the things and listen to the body with my hands. So I'm all tuned up, me and my scrubs, but I got to actually be home today. So I wanted to do today's reflections on the M factor, and we watched the screening documentary, this wonderful PBS show, The M Factor, Shredding the Silence on Menopause, as our last event at Direct Osteopathic. And I have to say, it was excellent. Even though it was a snowy night, it was a perfect mix of people and women who came together to watch this showing. And I took some notes and I wanted to share my reflections with you. And if you haven't seen the movie, you should. I will put a link in the comments so that you can download PBS, make a donation, and watch it yourself and have your own insights. There's a few really interesting things, so allow my reading glasses to kind of bring into light here. That's the most pertinent piece, I think, is that we're actually having a conversation now around menopause and around the fact that people have different experiences. I think that's excellent. I think it's about time. I've been practicing menopausal work since I was in my 20s, and I've been learning about how to support women in the hormone journey. And it is not easy, and it's very unique. Everybody has a very unique experience as they go through it, but universally, people who are born with ovaries will go through a period of time in their life when their ovaries turn on and make estrogen and go through puberty, and they'll go through a period of time in their life where their ovaries turn off and they no longer make estrogen. This is how it goes. It's a universal experience, and yet there's very little conversation around that. So the movie does a great job of bringing to light various perspectives throughout the show of the hormone journey and the challenges and the benefits and what that can be like. So I think that's wonderful. They do a wonderful job bringing in ethnic differences of the process of menopause. This is something that we learned about at the North American Menopause Association conference as well, and many of the physicians that are interviewed in the movie were at the conference I was at, so that was really lovely to see. The North American Menopause Society is a certifying body that certifies people, whether you're OBGYN or a family doctor or somebody who just works in hormone health with women. This organization has continuing medical education. They have tests, they have certification, they have conferences. They really put out a lot of data and position statements, and they're an excellent organization when it comes to women's health. And there are many of the physicians from that organization are involved clearly in this movie as well. So that was really cool to see. Very evidence-based, very scientifically based. Hi, Seiji. Seiji went through menopause too. She had to have a surgery just like normal spaying and neutering. And when they spayed her, I said, anything we should look out for? And they said, yeah, she might gain weight and be hungrier. And she is. So there you have it. That is in the movie as well. The body changes, but not as much as you would expect, actually. They don't really harp on that piece of it. But a couple of interesting things to point out. African American women, on average, go into menopause 1 year earlier than white women and last longer. 10.1 years on average versus 6.5 years for the transition on average for Caucasian women. Asian women, they have more bone pain, joint pain, and more like musculoskeletal pain in menopause than other ethnicities, and their osteoporosis risk is greater, which brought into point again, why are we doing bone density screening at 65 when women have a rapid bone density loss in their 50s when they go through menopause? So again, clinical questioning of guidelines that are established. Unless there's a risk factor, we do baseline bone density screening at 65. I think that should really change with the clinical understanding that somebody has gone through menopause and they have different risk factors or different symptoms or different ethnic risk for osteoporosis and family history. So that was helpful reminder. There's also quite a bit of information about the history of OBGYN profession as it pertains to slavery, and this Dr. Marion Sims, who they go into a large portion of this, like middle part of the movie, about some really terrible history around his use of 3 slaves in particular for understanding surgeries around vesicovaginal fistulas after childbirth, and it was very disturbing. So I had applied to many OBGYN programs. I debated heavily about being an OBGYN versus a family doctor, and I had never heard about this very difficult part of American history and American medical history as it pertains to that time. So the movie shed some really important light into that discussion. The other piece that I learned is that there are organizations, Genentech was featured in the movie, about creating some space in the workplace around menopausal changes and accommodating what that life experience is like, because they very clearly have a lot of women in their workforce, and they want to value the input of perimenopausal and menopausal women, but they also want to recognize the health challenges that people go through during that time. Thought that was very interesting. They also spoke very clearly to the lack of education, which I repeatedly try to explain to my patients. The reason why our hormone programs cost extra at Direct Osteopathic is because it takes me a lot of extra time, money, and training to be able to be an expert in women's healthcare and hormone health. So there was one statistic that 31% of medical schools have training in menopause. That's 78% approximately that don't. And even when they do have that training, it can just be a matter of hours or like a couple of slides. It's really piecemeal and it's not adequate. I really think the saddest part for me is that we really don't have that confidence in treating women's symptoms with hormone replacement therapy since the Women's Health Initiative, which they talk about a little bit in the movie as well. And getting our clinical confidence back on that has been a big journey, and helping patients to feel comfortable that it's okay to consider estrogen for your symptoms, and that there are safer versions of estrogen that were studied in the Women's Health Initiative, which was studied around Premarin, which we know is not a great choice. And also the timing. When is it started? There's this window of opportunity that they talk about in the movie, and it's super important to understand that as your hormones are fluctuating, you're going through perimenopause to menopause, don't worry, she's neglected. She's never pet. Just kidding. She's pet constantly, especially if she has the opportunity. Hi, baby, good girl. So women, when they are going through the change right at that precipice from perimenopause to menopause, so in the year-ish around when your period stops, that's a really important time to capture, to maintain bone density, to maintain resiliency in some of your tissues, and to really help with not only the symptoms of hot flashes and sleep and insomnia and brain fog and all of the pieces. That window from like 45-ish to 55-ish is super important. They don't give that kind of specificity in the movie, but that would be my clinical lens. After that, once symptoms have really calmed down, so in that 6 to 10 years past that journey, depending on your ethnicity, your age, and many factors, it's not really that helpful once you're 60 or 65 to start hormones then. And that was clear from the Women's Health Initiative, the study that made everybody afraid of hormones. That's when the hormones were initiated. So that was part of the problem of that study. And they don't really go into that much in the movie. They don't really break down what the trouble was with that study and how it just really gave us the wrong information. But they do talk about the consequences and the downstream effects of it, which, now we're back to having a conversation around menopause that is part of the mainstream. So that's great, right? Where our pendulum is slowly but surely swinging back the other way. They don't really talk much in the movie about the importance of getting your hormone levels tested, and it is very controversial, so I understand they really avoided controversial stuff altogether. Like they said, yes, some people use supplements, and then that was it. They didn't talk about which supplements or why. They didn't talk about pros or cons of that. They did mention, and it is important to be in, the care of an expert, an herbalist, a naturopath, somebody who's trained in functional and alternative and holistic medicine. They kind of did a little bit of speaking to that, but I would highly recommend, if you're watching this video and you're interested in a more natural approach to the menopausal transition, that you really guide yourself not just through AI and Dr. Google, but actually somebody who has training and expertise. I use acupuncture a lot, and local acupuncturists are not all versed in how to manage hormones in the endocrine system. So I have acupuncturists for lots of things and acupuncturists specifically for hormone balance. So that is a piece that they talked about, kind of glazed over, I would say, but you could definitely go deeper. And they did not talk much about individual hormone preparations or options for women. I think this is a challenge because, for example, testosterone, clearly helpful for women. Women have testosterone. We need testosterone as we go through the transition. Many things can be attributed to low testosterone, including your body mass index changing, having more fat, less muscle, having a harder time when you work out, losing weight, gaining more muscle. All of that can be related to testosterone, along with libido and sex drive. And yet, there is not an FDA-approved testosterone for women in the United States. So they leave that kind of at the cliffhanger, like, you can use the testosterone that's FDA-approved for men, but it's not great and it's not easy. And they do speak to that in the movie, which is excellent. But then they don't discuss compounding pharmacies, because that's a very taboo topic in Western medicine, and they don't discuss testosterone pellets, which definitely can, in my clinical experience, be overdosed and overutilized. Although people feel great, you can definitely have the side effects that we don't like to see with testosterone pellets, including thick blood and increased risk for high blood pressure, stroke, heart attack, etc. So they don't really get into risks and benefits of different hormone preparations, different hormone versions. And I think the common conversation I'm hearing right now is that, Instagram is like, yes, we have problems with hormones, we should talk about it. Same with Facebook, social media, this movie. I'm so grateful that we're having these conversations. But we're also swinging that pendulum back to hormones are all good. Everything is great about hormones. And that's not always true. There's still risks, right? And hormones still have to be monitored and managed and in the hands of an expert who knows what they're doing, so that you can be safe with your levels and making sure that you're not too low, not too high. They did speak to that in the movie. One of my patients said they don't say anything about levels in the movie, and they do. One of the OBGYNs says that you should have estrogen levels aimed to be between 20 and 100. The minimum threshold for bone health is to be over 20. I thought that was interesting. I hadn't seen that before, but that's a helpful piece of information. And I think the LabCorp, for depending on your age, the high level is like around 80-ish or below, but they say 100 here, which I think is fine. I usually use the minimal effective dose of estrogen. So what is the effective dose that helps your symptoms to be managed? When it comes to estrogen, we're talking about hot flashes, insomnia, irritability, and lubrication of joints and all the tissues of your body and your skin. Those are the things. A lot of people are driven to estrogen therapy because of their symptoms being unmanageable. And that is the primary one that we talk about with regard to risk and benefit. So that piece of the movie, again, they speak to the different hormones, the different players, estrogen, testosterone, progesterone, what their roles are, but they don't really speak about, cons or dosing or type or that kind of thing too much, which I understand why they would leave that out. But it's an important part of the conversation that we bring into every patient encounter, whether we're talking about our healthy hormones assessment programs or our healthy hormones maintenance programs. So for me as a clinician, I think they're leaving that to our individual, doctor-patient relationship, which is appropriate. So I thought that was interesting. And lastly, I think the broader conversation around healthy hormones that I like to have as a functional and alternative medicine-minded practitioner is the role of stress. They did talk about it as it relates to the African American community and the role of stress within the healthcare system, and really this kind of like deep rooted racism in our healthcare and how that can disproportionately impact different ethnicities. It came up a little bit in the movie there, and I do think that stress, whether it's racism related, whether it's socioeconomic, whether it is related to having 10, 20, 30, 40 years of relationship stress, or carrying the load, or managing work-life balance, parenting, whether it's related to adverse childhood experiences or trauma, stress cannot be discarded as an important factor. So for me, when I bring in my holistic lens, I'm always wanting to look at the broad playing field of the hormones in any assessment program. How has the chronic stress been? What are the adrenals talking about? How is your cortisol? We have to know that impacts weight around the middle. It's not just about lack of estrogen there. It's about the chronicity of your cortisol elevation. It's about, insulin regulation. It's about insulin resistance. We have to look at hormones like thyroid, as well as hormones like estrogen, progesterone, testosterone. And those broader picture pieces were not really brought into the movie. But again, this is a pretty standard middle of the road, meant to, hit the highlights, and it did a great job doing that. So thank you so much to the M Factor for bringing to light this discussion about menopause and making it a part of the conversation. If you haven't had a watch party with your friend or your family members or your doggy, you should probably do that, because I think it's really helpful. Right, Sage? She loved the movie. She'd like to snuggle up and watch a movie with me, huh? So check it out if you haven't already. The M Factor, it is on PBS. It is excellent. If you're interested and you're local to Colorado, we have our Healthy Hormones assessment programs and our maintenance programs now on our website, www.mydenverdo.com. No, Emily, hi. There are no other places to watch it other than PBS. And yes, there is a minimum donation there, but probably money well spent as far as public service and public education to make a one-time donation to PBS, but you can make a one-time or a monthly donation, or you can come if you're local on December 9th. We're going to have another event at Direct Osteopathic, and we'll be putting it up in a room probably and showing it as well. So if you missed it the last time with us, come on Monday, December 9th at 5. We'll show it again. And if you want to watch it another time, we could show it again, because it's excellent, and I think it's worth showing multiple times or having a watch party with your friends. All right, have a great day. Oh my, oh my.